Welcome to your neuropathy appointment. Your care manager will be with you momentarily. Please first learn about some of the symptoms and treatments for neuropathy.
About 20 million people in the United States, including more than half of all diabetics, suffer from neuropathy. It can cause weakness, numbness, and pain in hands and feet. Now a new therapy is helping people get back on their feet. For some, it's like electricity or pins and needles. Others feel like their feet are on fire.
The pain can shoot right through my legs.
For Eddie Jeffcoat, just walking across the street was almost impossible.
I might not make it back to the other side.
Eddie has neuropathy. Damaged nerves in his feet have left him homebound for the last 3 years.
It came where I couldn't stand, I couldn't walk.
But now he's walking his dog Bear.
I couldn't do this before.
Even enjoying his treadmill time. And he's done it all in just 90 days.
It's incredible. Most patients start to see results literally with the first treatment.
Dr. Mark Ott says the new treatment for feet and hands centers around an electric stimulator called the Rebuilder. It measures how a person's nerves are abnormally firing, then sends an electrical frequency to get the nerve back into a normal firing pattern.
So for each patient, the way that the unit actually fires is different. It builds a pattern that's specific to you.
While Eddie's still not up to full speed, he's lost 40 pounds and his pain level's been cut in half.
90 days ago, the pain was a 10. I mean, it hurt real bad. I'm at a 5.
This home unit can help reduce the pain even more. In the meantime, Eddie says the Rebuilder has made life a lot more bearable.
Come on, Bear.
We believe the most educated and knowledgeable patients will make the best decisions about their health care. It is first important to understand the 7 principles of integrated medicine. Patient-practitioner partnership. We are in this with you. We investigate the underlying causes. There are many when it pertains to neuropathy. We combine traditional and alternative treatments to get you the best outcomes. We consider all factors of wellness. We critically evaluate outcomes, and it's good medicine based on good science. Everything that we do in our office is backed by science. We use natural, less invasive interventions to prevent you from having to take more drugs or have surgery. There are 2 progressive degenerative diseases, osteoarthritis and peripheral neuropathy. There is no cure. If left untreated, both conditions will erode the quality of your life and threaten your independence. Just a few moments ago, you had a neuro exam, which tests large and small fibers of the nerve. You had cold, hot, vibration, sharp, dull, and light touch. In a moment, your case manager will go over the results to let you know how much sensory loss you currently have. Here are a few views of a healthy nerve, one that is moderately damaged and one that is severely damaged. As you will notice here, there is full blood vessels around the nerve. Blood vessels bring oxygen and nutrients to the tissue. Here is damaged blood vessels and moderate nerve damage. The less amount of blood vessels, the less amount of oxygen and nutrient, and the harder time it is for your nerve fibers to actually heal. Here's severe nerve damage. This begins to affect balance, coordination. You can experience slips and falls, or your legs and feet don't work as you desire them to. So what were your choices when you found out you had neuropathy? Was it surgery, exploratory? Is it possibly amputation? Medicine? What was recommended? Gabapentin, Neurontin, steroids, opioids, NSAIDs, antidepressants. Here are some of the side effects of non-steroidal anti-inflammatories: ringing in the ear, headache, rash, difficulty breathing, weight gain, high blood pressure, restlessness of limbs, constipation, and a variety of other things. We look at potential side effects of cortisone injections, which is cartilage damage, death of nearby bone, joint infection, nerve damage, pain and inflammation in the joint, increased blood sugar. This is important to know if you have diabetes, tendon weakening and rupture, and thinning of nearby bone, which is osteoporosis. So we like to take a more natural approach than using steroids to manage pain. Common side effects of gabapentin, which is a commonly prescribed medication for neuropathy: drowsiness, weakness, dizziness, headache, tremor, blurred vision, anxiety, memory problems, nausea, vomiting, heartburn, dry mouth, constipation, increased appetite, back and joint pain. Please let your care manager know if you are suffering from any of these side effects. Home treatment and regenerative medicine therapy are two of the options we use in this office. It's an alternative to drugs and surgery, which includes light therapy, nerve stimulation, nutritional supplementation, and regenerative medicine, which harnesses the body's innate intelligence to restore, remodel, and regrow tissue, bone, ligament, tendon, and cells. So we use a 4-prong approach: nutrition, motion, regenerative therapies, and home support. What are stem cells? They're undifferentiated cells that have the capacity to both differentiate and multiply into 200 cell types that form us as human beings. We will let you know if you're a candidate for this service. I do want you to understand a little more about the impact of aging on the ratio of stem cells to bone marrow cells. When you're born, you have 1 stem cell to 10,000 bone marrow cells. You can see as you progress in age how that goes down very quickly. If you're 50 years old, you have 1 stem cell per 400,000 bone marrow cells. And your cells are as old as you are. This is why our body cannot repair or regenerate as quickly as it used to. And there are many factors. Are you healthy? Is your body inflamed? Do you have any other disease processes? So let's look at it here. If you are a candidate for regenerative therapies to handle some neuropathy symptoms, these are the different options available to you. Steroids, we have talked about the negative impacts on that. And then there's 3 different types. We use adipose, which is fat, and then bone marrow derived stem cells. Both of these 2 options are invasive and do require a surgical procedure. We prefer umbilical cord tissue, which is taken from donated birth tissues from mothers who are pre-screened and have cesarean sections. This includes anti-inflammatory properties, antimicrobial growth factors, it's non-toxic, it can change into different cells, and there is stem cell located within them. Platelet-rich plasma is another service that we provide in order to nourish the cells that we put into the body. There is also amniotic fluid, which is a fantastic product that we use. It does have the absence of stem cells in it. Treatment options at home would be a nerve stimulator, which we see here, a low-level cold laser to help with pain and inflammation, LED light therapy to create more blood vessels in your lower legs and feet to bring more oxygen and nutrients to the area, nerve and neuropathy cream, nutritional supplementation that helps healing from the inside out, and vibration plate that stimulates the nervous system. We are not a one and done clinic. We focus on regenerative and PRP injections, specialized nutrition, additional support such as chiropractic, manual therapy, stimulation, light therapy, and then of course at-home therapies, which could be all of the images that we just went through, or some of them would be prescribed for you. You will have online support with My Body site, how you're visiting us today. In just a moment, you'll meet with your care manager. Please be as honest as possible so we can help you achieve the results that you need and want. When you're complete here, please click on the chat box and write done, and your care manager will be right with you.